My name is Varshni Shrinash and I invented Pharos, an app preventing health risks through AI-reported outcome and utilizing social determinants. Imagine a world where chronic illnesses are no longer the leading cause of death and disease worldwide. Up to 80% of these chronic illnesses are preventable, but healthcare systems would rather focus on the treatment of these than the prevention of these. So that's where social determinant factors come in. These social determinant factors include diet, mental health, and etc. And they are proven to influence health outcomes, but they are not tracked in our day-to-day life or medical care. So my solution to this is an AI-powered risk assessment system using daily patient-reported health data and passive tracking from smart devices to generate personal risk scores, enabling early detection and prevention of chronic illness before the symptoms appear. My originality of this app, is very unique because no one is really using social determinants per se, such as Apple Health, MyFitnessPal, Fitbit are all doing statistical data points such as how much you walk, how much calories did you eat, like how much hours did you sleep. So all of these things play an important factor too, but also the mental health and the stress, the air quality also plays a humongous effect on chronic illnesses and the preventability in them. My first prototype was very simple. It was just a doctor dashboard where the doctor would type in the social determinant factors of the patient. But I wanted to create a more patient-based app. So then in my second one, I created a patient dashboard where they could type in their survey and put in their factors. But I wanted to go even more beyond that and see what specifically are their risks and why is their risk coming out to this. So if we go on the patient dashboard, we see that we can see how much glasses of water did you drink today. You can put that in, fill that out. We see the health metrics. We can see the rewards and streaks. We can also go see the insights, so it gives you recommendations based on your personal thing, your health trends. We can also see your rewards, so your daily streak is 700. And I've also connected it with my Apple Watch, and so we can also see like specific data from steps and heart rate and things like that. And on the doctors, we get a holistic view of how much all the patients and what their conditions might be, and we also see their things like that. So we can go and view and we see fully like their overall risk score, which is 82, and we get the breakdown of that. And we see that hypertension is 85%. We can see their compliance score, we can see we can give them recommendations, and we can see their doctor notes. So in this app, we not only get a holistic view of everything, but it also predicts chronic illness early and combines the doctor's history of their medical history and their social determinant factors to prove that, okay, they have this chronic illness most likely. And it also reduces the unnecessary visits of hospitals because patients don't need to come in as much because doctors can already be tracking them over a period of time rather than only coming in for like no reason and coming in when it's critical for them. And how it works, as I mentioned before, is just what I walk through. And for AI and machine learning, I've been using like large-scale medical studies and predictive health models to determine based on multiple different factors on the increase of like the risk. So like it would have to use chronic stress plus poor sleep would increase the risk of hypertension and stroke. So multiple factors increase the risk score, not just one. And next steps that I plan to do is integrate it with pharmacies for medication tracking to see that doctors can see how adherence they are to medications and all these things. And also I want to create a customized action plan for patients who are high risk for a chronic illness and offer in-coach app, like coach for the app and patients so they can better themselves. And in marketing, I asked doctors, nurses, and different patients and different people about are they using any app right now to track their health, and most of them said no, and they would be open to considering them. And a lot of people like the app that Pharos is providing and what it's providing. And a lot of people said that they really liked Pharos if it included rewards and they would be more incentive to using it. And a lot of people have said that they've never seen anything like Pharos before, which leads a big market proposal and big market value right now in the market. So we can tell that by not anyone seeing this but wanting it, it can be a lasting impact on people's life, and not only people's life but doctors' lives as well. Thank you for listening. Proactive today, preventative tomorrow.